Question 1. A patient receiving gentamicin, 4 reports ringing in the ears. What is the priority nursing action? A. Continue the infusion and document the finding. B. Notify the healthcare provider immediately. C. Administer diphenhydramine for the symptom. D. Reassure the patient that this is a normal side effect. Answer. B. Notify the healthcare provider immediately. Question 2. A nurse is caring for a patient receiving lithium. Which finding requires immediate intervention? A. Mild thirst. B. Fine hand tremors. C. Nausea and diarrhea. D. Polyuria. Answer. C. Nausea and diarrhea. Question 3. A patient taking warfarin has a new INR of 5.2. What is the nurse's priority action? A. Hold the next dose and call the provider. B. Continue the dose and monitor for bleeding. C. Give an extra dose to lower the INR. D. Instruct the patient to avoid green leafy vegetables. Answer. A. Hold the next dose and call the provider. Question 4. A nurse administers morphine and observes respiratory rate drops to 8 per minute. What is the immediate action? A. Administer naloxone. B. Apply oxygen via nasal cannula. C. Reassess in 15 minutes. D. Place the patient in high Fowler's position. Answer. A. Administer naloxone. Question 5. Which patient receiving digoxin requires the most immediate follow-up? A. Complains of blurred vision. B. HR of 58 BPM. C. Reports fatigue. D. Takes the drug with food. Answer. A. Complains of blurred vision. Question 6. A nurse should question a prescription for metformin in which patient? A. Diagnosed with type 2 diabetes. B. Scheduled for contrast CT scan. C. Who eats low carbohydrate meals. D. Recently diagnosed with hypertension. Answer. B. Scheduled for contrast CT scan. Question 7. A patient taking isoniazid develops numbness and tingling in the hands. What should the nurse do? A. Document as expected. B. Hold the dose and notify provider. C. Administer vitamin B6 as prescribed. D. Encourage fluid intake. Answer. C. Administer vitamin B6 as prescribed. Question 8. A nurse is delegating care to a UAP. Which medication-related task is appropriate to delegate? A. Administer oral meds. B. Apply a transdermal patch. C. Report side effects such as dizziness. D. Document medication administration. Answer. C. Report side effects such as dizziness. Question 9. Which patient taking furosemide should the nurse assess first? A. Complains of leg cramps. B. Urine output of 1,500 milliliters per day. C. Reports thirst. D. Blood pressure of 118/76 mmHg. Answer. A. Complains of leg cramps. Question 10. A nurse is caring for a patient taking clozapine. Which finding is most concerning? A. Sedation. B. Dry mouth. C. White blood cell count of 2, 800/mm superscript 3. D. Weight gain. Answer. C. White blood cell count of 2, 800/mm superscript 3. Question 11. A nurse receives a new order for vancomycin 4. What is the most important baseline assessment? A. Liver function tests. B. Audiometry screening. C. Blood pressure. D. Renal function tests. Answer. D. Renal function tests. Question 12. A patient on ACE inhibitors complains of a persistent dry cough. What is the appropriate response? A. Reassure the patient that this is expected. B. Withhold the drug immediately. C. Instruct the patient to stop the medication. D. Notify the provider to consider another class. Answer: D. Notify the provider to consider another class. Question 13. Which patient taking spironolactone needs immediate intervention? A. Has potassium level of 5.9 milliequivalent/L. B. Reports mild dizziness. C. Has blood pressure of 110/72 mmHg. D. Complains of fatigue. Answer: A. Has potassium level of 5.9 milliequivalent/L. Question 14. Which symptom indicates a possible adverse effect of levothyroxine overdose? A. Bradycardia. B. Constipation. C. Weight gain. D. Chest pain. Answer: D. Chest pain. Question 15. What should a nurse do when a patient on MAOIs wants to eat aged cheese? A. Allow in moderation. B. Warn about risk of hypertensive crisis. C. Recommend increased water intake. D. Suggest monitoring for nausea. Answer: B. Warn about risk of hypertensive crisis. Question 16. Which instruction is most important for a patient prescribed alendronate? A. Take with food to avoid nausea. B. Remain upright for 30 minutes after taking. C. Take at bedtime with full glass of water. D. Combine with calcium supplements. Answer: B. Remain upright for 30 minutes after taking. Question 17. Which finding in a patient receiving amiodarone requires immediate action? A. Skin discoloration. B. Productive cough and dyspnea. C. Heart rate of 68 BPM. D. Mild nausea. Answer: B. Productive cough and dyspnea. Question 18. Which patient taking a beta blocker should be assessed first? A. Reports fatigue. B. Has a heart rate of 52 BPM. C. Blood pressure of 118/78 mmHg. D. Reports mild cold extremities. Answer: B. Has a heart rate of 52 BPM. Question 19. A nurse administers promethazine for. What is the most serious complication to monitor for? A. Headache. B. Hypertension. C. Tissue necrosis. D. Nausea relief. Answer: C. Tissue necrosis. Question 20. Which task related to narcotic administration can the RN delegate to an LPN? A. Assess pain relief after 4 morphine. B. Evaluate effectiveness of PRN order. C. Administer IM hydromorphone as prescribed. D. Monitor respiratory status post-op. Answer: C. Administer IM hydromorphone as prescribed. Question 21. A nurse is reviewing lab results for a patient on heparin. Which value requires immediate intervention? A. APTT of 90 seconds. B. Platelet count of 250/000/mm superscript. C. INR of 1.1. D. Hemoglobin of 13.2 g/dl. Answer: A. APTT of 90 seconds. Question 22. A nurse is caring for a patient taking phenytoin. Which finding is most concerning? A. Gingival hyperplasia. B. Rash with blisters. C. Drowsiness. D. Mild dizziness. Answer: B. Rash with blisters. Question 23. Which patient taking prednisone is at highest risk for complications? A. Patient with uncontrolled diabetes. B. Patient with rheumatoid arthritis. C. Patient with COPD. D. Patient recovering from surgery. Answer: A. Patient with uncontrolled diabetes. Question 24. What is the nurse's priority action before administering metoprolol? A. Assess respiratory rate. B. Check apical pulse. C. Review sodium level. D. Evaluate urine output. Answer: B. Check apical pulse. Question 25. A patient on fluoxetine reports increased energy and insomnia. What is the appropriate nursing action? A. Encourage increased physical activity. B. Assess for signs of suicidal ideation. C. Reassure that the effects are temporary. D. Administer dose at bedtime. Answer: B. Assess for signs of suicidal ideation. Question 26. Which medication order should the nurse question for a patient with asthma? A. Propranolol. B. Albuterol. C. Monteliacast. D. Fluticasone. Answer: A. Propranolol. Question 27. What is the nurse's priority when caring for a patient prescribed methotrexate? A. Monitor liver enzymes. B. Assess deep tendon reflexes. C. Check fasting glucose. D. Evaluate cardiac enzymes. Answer: A. Monitor liver enzymes. Question 28. Which task is appropriate for a UAP assisting a patient receiving opioid analgesics? A. Count respirations every hour. B. Evaluate pain scale. C. Report increased sedation. D. Adjust oxygen flow rate. Answer: C. Report increased sedation. Question 29. A patient on carbamazepine reports flu-like symptoms. What is the nurse's best action? A. Instruct to rest and increase fluids. B. Assess for signs of infection and notify provider. C. Encourage OTC cold medications. D. Document findings and reassess in 24 hours. Answer: B. Assess for signs of infection and notify provider. Question 30. A nurse prepares to administer 4-potassium chloride. What is the correct action? A. Infuse by 4 push over 5 minutes. B. Mix with 50 milliliters of dextrose and give rapidly. C. Use a pump to administer slowly via 4 infusion. D. Dilute in normal saline and give intramuscularly. Answer: C. Use a pump to administer slowly via 4 infusion. Question 31. Which patient taking atorvastatin should the nurse assess first? A. Complains of muscle pain. B. Has LDL of 130 milligrams per deciliter. C. Reports mild fatigue. D. Eats high-fat meals. Answer: A. Complains of muscle pain. Question 32. A nurse is caring for a patient taking an allopril. Which adverse effect is a priority to report? A. Cough. B. Swelling of lips and tongue. C. Dizziness. D. Headache. Answer: B. Swelling of lips and tongue. Question 33. A patient on levetiracetam becomes agitated and aggressive. What is the nurse's best action? A. Continue medication and document mood changes. B. Notify the provider immediately. C. Administer a sedative. D. Request a psychiatric consult. Answer: B. Notify the provider immediately. Question 34. Which statement by the patient indicates understanding of nitroglycerin therapy? A. I can take more than 3 tablets if chest pain continues. B. I should keep the tablets in a clear plastic pillbox. C. I should expect a headache after taking the tablet. D. I should swallow the tablet whole with water. Answer: C. I should expect a headache after taking the tablet. Question 35. Which patient taking methyldopa should be monitored closely? A. A patient with liver disease. B. A patient with high blood pressure. C. A patient with anemia. D. A patient with glaucoma. Answer: A. A patient with liver disease. Question 36. Which instruction is most important for a patient taking bisacodyl? A. Take with a glass of milk. B. Avoid crushing the tablet. C. Take with meals. D. Use daily for regular bowel movements. Answer: B. Avoid crushing the tablet. Question 37. A nurse is caring for a child receiving methylphenidate. What is the most important assessment? A. Weight and height. B. Urine output. C. Blood glucose. D. Oxygen saturation. Answer: A. Weight and height. Question 38. A nurse is monitoring a patient on clopidogrel. Which finding requires priority intervention? A. Bleeding gums while brushing. B. Reports black, tarry stools. C. Reports mild bruising on arms. D. Headache after taking medication. Answer: B. Reports black, tarry stools. Question 39. Which task is within the LPN scope related to medication safety? A. Educate patient on side effects of new drugs. B. Administer 4-push medication. C. Administer routine oral medications. D. Titrate vasoactive drips. Answer: C. Administer routine oral medications. Question 40. What is the nurse's best action for a patient experiencing serotonin syndrome from SSRIs? A. Reassure the patient and monitor for 24 hours. B. Hold medication and notify the provider immediately. C. Provide acetaminophen for muscle rigidity. D. Encourage oral fluids and deep breathing. Answer: B. Hold medication and notify the provider immediately. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!